This is a kidney, normal kidney. What is here?
Process.
Necrosis. Very good. So this necrosis or infarction, same thing. So this is a white, a red, as the name says. What? White or red?
White.
White, pale, same. Pale or white is the same meaning. So this is a pale infarct. Pale infarct, what is the most likely cause of pale infarct? Less blood supply, very good. So reduced blood flow. Ischemia. Ischemia means any blockage. So this wedge shaped pale area means white area, is a coagulative necrosis, and coagulative necrosis is always because of ischemia, except in the brain. Yes, leave the brain, not in the brain, but all other parts this is usually because. So what is the most likely cause of this problem? Ischemia, reduced blood supply. And what is your diagnosis? This is pale infarct, or you can say coagulative necrosis. Okay. Same. Now here, which area is normal, which is abnormal? This is normal, and this area is. So what type of necrosis is this? Coagulative necrosis. Very good. Because the outline is maintained, structures are maintained. You can still see the image like this. One structure, here again structures present, but only the nuclei are gone. Okay. So when the structure is maintained, we call it coagulative necrosis. But the cells are dead. Okay. One thing. Okay. What is the most likely cause, as we discussed? Ischemia. Not in the brain. Okay. In the brain, it will cause ischemia. Okay. This is a cavity. So this cavity is because of which type of necrosis? Leukoaffective. And most important cause of leukoaffective necrosis in brain is ischemia. So you can see this cystic space. This is a leukoaffective necrosis in the brain. In the brain, leukoaffective necrosis is caused by ischemia. Leukoaffective necrosis in other part of the body is caused by infections. Very good. Okay. Now you can see another area. So brain, ischemia of the brain, okay, leading to this leukoaffective necrosis. Okay. Same. This is again the pale area. This is all leukoaffective. This is normal. This is normal, and this is leukoaffective. And again, the most common cause of leukoaffective necrosis in the brain is ischemia. Now, which type of necrosis is this? Caseous necrosis. Very good. So this is like a cheese. Very good. Okay. So this is a caseous necrosis. What is the most important cause? Mycobacterium tuberculosis. So tuberculosis is the most important cause of this. Okay, this is another necrosis. Fat necrosis. Okay. One of the important cause of fat necrosis is acute pancreatitis. Acute pancreatitis because their enzymes like lipases which can digest the lipids.
Excuse me, just 2 minutes. السلام عليكم شباب. بشان السبيل ان شاء الله كلكم مشاركين. وعلم معروف وهي الاستفاده لك لانه لو اعتمدت الكليه اكاديميا انت بتكون خريج جامعه كليه اكاديميه. اوكي؟ وثانيا بتجي لجنه الاسبوع من ابتداء من بكره. احتمال تجي اللجنه باي وقت. ايضا من الاعتماد الاكاديمي لازم تكون لابس اليونيفورم. البالطو ولا تجيب
لازم نلبس
البالطو.
اذا كان لازم نلبس كوت.
كيف؟
اذا برا اللعب عادي
احسن يعني لانه احتمال يقول لك العميد قال انه احتمال هم بالممر يمروا بين اللابات يوقف اي طالب يسالوا ليش يا ابني انت طالب هنا انت فلما يشوفك العميد ولا هم بيكونوا معاهم العميد والوكيل مش حلوه بصالحك فالاحسن نكون ملتزمين مع باقي الاسبوع الجاي فنكون هكذا يوميا باي يوم ممكن يجوا وهذا ايضا يخدمك كما قلنا لكم اذا انت اعتمدت اكاديميا اذا الجامعه الكليه اعتمدت اكاديميا انت بتستفيد تكون خريج كليه معتمده اكاديميا. اوكي شباب فالتزموا رجاء والاستبيان شاركوا فعالين وبيجينا مثلا جينا فيدباك من هناك من الاعتماد الاكاديمي برئاسه الجامعه باداره الجامعه يقولوا شاركوا بس هذا الطلاب ارقامهم الجامعيه هذه والعميد بعدين بيأشر ويرفع الدرجات من يشاء يلا اي خدمات.
So this is fat necrosis, and due to most important cause is acute fat. Yes, please. Okay, this is again fat necrosis. Okay, so now you can see the fat cells, and now here you can see the all dead cells. So this fat necrosis again most likely caused by acute fat. This is another fifth type of necrosis. Okay, so in the vessel, so this is a pink. Pink is like fibrin. So fibrin is a pink. This is a fibrin. Fibrin is a protein in the body. So it gives the color of fibrin. So we call fibrinoid necrosis. Okay. So fibrinoid necrosis usually because of antigen antibody reactions. Yes, complex, usually in the vessel. Okay. So this is fifth type of necrosis. Now you can identify all these types.
Yes.
Okay. Coagulative necrosis. Coagulative necrosis because of ischemia. Okay. Liquefactive necrosis again because of ischemia. Liquefactive necrosis good. Liquefactive. Caseous necrosis because of tuberculosis. Fat necrosis. Fat necrosis because of acute bacteria. This is fibrinoid necrosis because of antigen antibody complex formation in the vessels. Sometimes you find this. This is special type of another necrosis. So with black color. Yes, gangrene. Gangrene can be of two types. Either dry gangrene or wet gangrene. Dry gangrene is usually coagulative necrosis because of ischemia. Usually occurs in diabetes. The people who have uncontrolled diabetes, ultimately they develop this gangrene, and then we have to cut the limb. Have you seen any patient who has developed this? But this is one of the important. Then if infections occur of this, so this gangrene, if infections occurs of this, so infection will cause liquefactive necrosis. So coagulative necrosis followed by liquefactive necrosis. This will be a wet gangrene. So what is meaning of wet? Dry mean
Coagulative necrosis.
dry mean
Coagulative necrosis.
no, dry meaning of dry
No.
without water. Yes. So wet mean with water.
Yes.
So which mean so basically dry mean this is less shrunken,
Yes.
and wet mean it is like a swollen. Yes, like
Does it become like the dry ganglion? Does it become wet when there's a
no,
second
it can
infection?
no, it can become because dry gangrene if infections occur on this, it will become wet. While if you remember there are two types of bacteria. One bacteria which requires oxygen like us,
Yes,
we
yes.
require oxygen.
Aerobic.
Yes, there's bacteria anaerobic.
Anaerobic.
So when there's no blood supply,
It's anaerobic bacteria.
so anaerobic bacteria can attack this and lead to infections, and which is very dangerous. Okay, same gangrene. Okay, most likely cause is again ischemia.